The goal of this hearing is to stop the entire baby formula market from being at risk when there's bacterial contamination in a factory. So I want to figure out how much progress we've made toward that goal by looking at what would happen if the Abbott contamination were to repeat itself. So Mr. Yanis, let's say that a major formula manufacturer, and there are only a handful as you know, finds bacteria in their supply today. Does the law say the factory has to tell the FDA?
The answer to that is no, other than the Abbott Sturgis facility, which, as you know, is under consent decree.
So I think this is really important that everyone hear this, so I'm going to ask you one more time. Let's say that a major formula manufacturer, a factory, found bacteria in their supply today. Does the law require them to tell the FDA?
The answer is no. They should, but they're not required by law.
But surely the FDA is now keeping a close eye on supply so that they're ready for any disruption. What resources and authorities are now in place for the FDA, even though they have no requirement that anyone tell them, but should the FDA learn, what are the resources available for the FDA to do supply monitoring?
That's an area of the program that needs further development. Historically, the FDA has been focused on food safety and nutrition, not supply chain availability. But after the pandemic, which I describe as the biggest test on the U.S. food system in 100 years, we all realized that as an agency, we needed more intelligence and data on how companies and supply chains actually worked. There were attempts to try to build those capabilities internally. They were met with a lot of resistance because it wasn't part of the core mission, but I'm grateful that Congress, through the omnibus, has asked FDA to set up an Office of Critical Foods and to develop those type of capabilities.
Do you think the Office of Critical Foods, as structured in the omnibus, will go far enough in supply chain monitoring? And are we making fast enough progress in getting it going?
We started making progress before the infant formula crisis. Early during the pandemic, we knew that while the virus didn't cause transmission or illnesses through food, we knew it would wreak havoc to the food supply chain because ill workers, if not available, would affect supply chain continuity. And so we started to build those capabilities on what I describe as a shoestring budget without authorities, but it hasn't gone far enough. Although requests for additional fundings have been made to the commissioners and acting commissioners, like I said, it's been made with resistance. I think after the COVID or after the recall of 2022, now there's a greater appetite. Progress is being made, but it's not being made fast enough.
Mr. Yanis, since the law doesn't require, as we just learned, factories to report contamination, what incentives do monopolistic or a small number of suppliers, monopolistic companies have to self-regulate? I mean, the market isn't forcing the level of competition on quality, and the FDA is still building out its monitoring apparatus.
I think there's one critical component that was mentioned in the opening comments is public health surveillance. Our ability to detect illnesses in society and learn about why they occur, what are the food vehicles that cause them, what are the contributing factors, is critical to informing future prevention. Today, Chronobacter sakizaki is not a reportable disease other than 2 states. And so that's a real disincentive for the industry to know what's really happening and for them to take corrective actions. So I would say the time is now for us as a nation to make Chronobacter sakizaki a nationally notifiable disease and reportable in all 50 states.
And I really appreciate it in your testimony that you came to us with concrete actions that we can take to actually address and better prevent this. So I noticed that was your #1 recommendation in your list of 11. Dr. O'Leary, with my remaining time, can I ask for your thoughts on how far you think reorganizing the Human Foods Program will go toward creating the proactive FDA that we all need to be safe?
Yes, well, I don't think one should overstate what can be accomplished through a reorganization, but I do think that what Commissioner Califf has come up with is a very reasonable attempt to, on the one hand, strengthen the food program, giving it the kind of prominence within the agency that it has for a long time lacked, and yet at the same time to do so in a way that acknowledges the way that the agency is currently structured, such that any new situation is not unduly disruptive. And I think that they've done a pretty good balance of that. We have never had a deputy commissioner over the entire foods program before. Even when Mr. Yanis was there, I'm sure he'll be the first to say that he never had that kind of authority. But the vision currently is to do exactly that and to elevate foods within the program in a way that has never been the case before.
Thank you very much. I yield back.
Thank you, Ms. Porter.